Good afternoon, everyone. My name's Ella, and it's my pleasure to welcome you to our webinar, Stigma Training Initiative. I'm pleased to be welcoming Srinath Maddur, who's our speaker for today. This webinar is taking place on October 30th, 2024, and we are recording the webinar today so that we can share it with people who might not be able to attend. This webinar is organized by the Manitoba HIV-STBBI Collective Impact Network. This is a network of innovators working collaboratively to transform the landscape of HIV and STBBIs in Manitoba. We bring people together to tackle complex HIV and STBBI systems barriers, and we seek systems change by shifting the conditions that are holding the problems in place. I'm speaking to you today from Treaty 1, Winnipeg, Manitoba. We acknowledge that we work and gather on the original lands of the Anishinaabe, Ojibwe, Cree, Oji-Cree, Dakota, Lakota, Inuit, and Dene peoples, and on the homeland of the Métis Nation. Here at the Collective Impact Network, we are humbly working towards the Truth and Reconciliation Commission's calls for action and the Missing and Murdered Indigenous Women and Girls Inquiry's calls for justice through our research, events, and projects. If you would like to find out more about the Collective Impact Network, sign up to receive our newsletter, or find our social media and YouTube page, you can do so at cinetwork.ca. This webinar is part of our ongoing efforts to provide education, and you can find past resources on our YouTube page. For our presentation today, if you have a question, the question and answer period will follow the talk, and you can type your questions into the Q&A feature, and you can type your questions at any time throughout the presentation. So it's my pleasure to introduce Srinath Maddur. Sri is a health educator at Nine Circles Community Health Center and the coordinator for the Stigma Project, specializing in sexual health and harm reduction. With extensive experience in HIV interventions and capacity building, he is passionate about community engagement, tackling stigma, and supporting community-led initiatives that meaningfully involve marginalized groups. The Stigma workshops are co-facilitated by individuals with lived experience, and Sri will be talking today throughout his presentation about the project, as well as enriching the dialogue and fostering a deeper connections to the topics discussed. Take it away, Sri. You're on mute, classic.
Sorry about that. Thank you, Ella, and thank you to the Collective Network also for inviting us to present our work today. Welcome, everyone, and thank you for being here today. My name is Srinath Maddur, and I'm a health educator and also the coordinator of the Stigma Stigma Project. I am struggling here with sharing the screen, but as soon as I'm done, I should be pretty okay with it. Just give me a moment. Excellent. So it looks like you're able to see the screens there. And I'll go to the full. Hopefully you're able to see the screen now.
Looks perfect.
Excellent. Thank you. I should have been joined by my teammates. That would be Rob and Cody. They're unable to do that today. Unfortunately, it would have been wonderful if they were here, just to kind of give us a perspective of what their experiences were when delivering this workshop. So before I begin, I would like to respectfully acknowledge that Nine Circles Community Health Center operates on the original lands of Anishinaabe, Cree, Anishinaabe, Assiniboine, Dakota, and the Dene people, and on the homeland of the Red River Métis Nation. We want to acknowledge the treaties that were made on these territories, the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. I also want to take this moment to acknowledge the history of HIV and sexually transmitted infections. Stigma has been harmful to people of all genders, two-spirit, LGBTQ+, sex trade workers, immigrant communities, people who use drugs, and the many other marginalized sections of our society. Today, we will have a chance to share what we know, learn from each other, and hopefully take back some of our learnings so that actually we can break down the harms of stigma and discrimination. I know this slide whenever I'm looking at it, kind of comes back to me, why are we still talking about this? So, eh, well, when we say that, it is time for action. So HIV stigma, also the STBBI stigma and discrimination remains prevalent in Canada as we speak. And despite those major medical advances, we still continue to face that stigma has serious consequences, just not emotionally, but also physically, mentally, for people who are actually living with STBBIs or wanting to get tested for STBBIs as well. So when individuals face stigma, we know that it causes significant stress, worsens their mental health outcomes, impacts on their ability to access healthcare, adhere to treatment schedules that have been prescribed, or even compliance, and sometimes even accessing some of the social entitlements. Research has clearly shown that stigma leads to higher viral loads, poorer mental health, reduced quality of life, and substance use as well. On top of this, stigma seems to have a major barrier that keeps people from engaging with healthcare services in the first place. That's been the biggest barrier of it all. So we also know that stigma doesn't exist in isolation. It intersects with systemic racism and other isms, furthering marginalization of individuals and deepening the health inequities. Change requires more than just public health campaigns. We know that for sure. It has to happen within the healthcare settings or the social service settings, so that's where people seek these services. So I think that's where it probably needs to begin. We have enough evidence to talk about that. So to give this some context, here's a quote from a study participant, and this is what they get to say is, I see people being sexually active and not talking about it because they care too much about the way they feel they will be seen by others or by the community. It is stigma, especially for females. I feel like they're more judged in the community and stuff. They will just keep things to themselves, even if they're sexually active, even if they have questions or concerns. This quote kind of highlights the way stigma can silence people, keeping them from seeking help or even accessing some of the services. This is where, as service providers, we can make a real difference by fostering a safe, inclusive space for those who actually seek our service. In today's webinar, I will walk you through our experiences delivering these stigma reduction workshops in the last year, and the project details and the goals and breakdown of the different workshop modules that is there, and also some of the key findings from our initial workshops. So let's get started. I would like you to kind of explore what is stigma. And to do that, let's kind of define what stigma is. So the United Nations HIV/AIDS program describes stigma as a dynamic process of devaluation that significantly discredits an individual in the eyes of others. In other words, stigma happens when certain traits like health status or behaviors are labeled as shameful or unworthy within specific cultures or environments. One of the simplest ways to understand stigma is through the words of a client. And here's what they say. Stigma is like the air. You don't see it, but you feel it. It is something very subtle but deeply felt, shaping how people experience the world around them. When this stigma is enacted upon, it definitely leads to discrimination. And we know discrimination can take different forms, whether it's denying someone to access healthcare, excluding them from seeking opportunities, or treating them unfairly based on assumptions. This is why it's so important for us to, as providers, to understand the challenge of stigma, and also to show up, that it can show up in ways that we might not immediately recognize it, but deeply impact the people that we serve. I would also like to state, I did not put this on the slides, but I would like to kind of state from a study that was done by the Canadian Public Health Association, in the lead up to developing some of these modules. Here's some conversations that they bring up when they had these conversations with people who seek services. One of the client went on to state that my family doctor knows how to open up the discussion by just asking, how was your day? That's one statement, a very friendly approach. And here's another communication bit. I like to be talked to with empathy, as if I'm someone they care about and want to help. Talking talking in a very clinical way leaves out the social and emotional parts of having HIV or an STI. That's another statement. That's the communication bit of it. And there are sometimes, as healthcare providers, we tend to make some assumptions. And here's one of those statements. When the clients talks about this, they say that a total lack of sensitivity or strong, say, heterosexism, like asking a gay man, do you have a girlfriend? Or telling a lesbian that she should be on birth control because she says she's sexually active. These assumptions immediately shut down discussions about sexual activity or the number of partners and sexual risks. That's a profound statement there. And I have another one that I thought I should share during this webinar. It's about the environment, the organization structure, the institution per se, that also impacts how people feel when they come and access our services. So here's a statement that one of the clients talk about. Even when I go into a doctor's office, I look around the waiting room to see if there is anything aboriginal in there, even a blade of sweetgrass, some sign that the healthcare provider is aware of aboriginal culture. So these are the many things that came up to several rounds of consultation with people, which led to the development of these stigma modules. So let me take you through what's happening at our end. So 9 circles. Oh my God, what's happening? Okay. Sorry about that. So 9 Circles has been selected as one of the 4 partners across Canada through this opportunity from the Canadian Public Health Association and the Center for Sexuality. And we're very lucky to get this project. It starts for 4 years. We began already in September 2023 and go on till March of 2027, where 9 Circles, in partnership with very many different partners here in Manitoba, will lead the STBBI stigma reduction interventions right here. So the main focus of this project is actually to enable health as well as social service professionals to provide care that is safer, more inclusive, and free of stigma. This means that we'll be working closely with providers from across the province to ensure that sexual health, harm reduction, and STBBI-related services are delivered in a way that fosters and promotes equitable healthcare for everyone. This project is a crucial step towards creating environments where people feel safe accessing supports that they need without the fear of judgment or exclusion. By the end of the 4 years, we hope to make meaningful progress in shifting how stigma is understood and addressed within the specific healthcare settings in Manitoba. When I say specific healthcare settings, I mean to say that we'll be working very closely with people who are providing STBBI services or harm reduction services in the province. So what's so unique about this stigma reduction workshop? So I'm not saying this from my own experience, but I'm also quoting this from several studies that have happened, the pilotings that have been done across Canada. And also some of the results come from my own experience, from our own experiences having delivered these workshops for the last year. So our workshops engage participants through activities, practical exercises, real world scenarios, and this approach makes learning experience dynamic and ensures that participants can immediately connect with what they've learned to their daily work as well. Once they go back to the desks, it probably starts kicking in. That's the expectation. And we provide essential frameworks and concepts that help participants feel confident and effective in addressing stigma in their professional settings. Here are 2 examples or 2 feedback statements that people have given us soon after the training was over. And these were provided by clinicians. Here's a statement. The first one goes like this: I understood more about what stigma means and how to approach it better. And another person goes on to say, I've learned how to make people comfortable with sharing with us what they are here for and not judging them. So in a way, the sooner they happen to get this training, is just not the knowledge part of it, is also realization that, hey, I'm actually living with these mindsets, and it's important that this does not come in my conversation piece. So these statements are very profound and kind of tells us the real nature of these trainings. So in terms of experience sharing, there's reflection and collaboration at the heart of this workshop. Participants learn from each other's experience. That's the collective learning, which fosters a deeper understanding and also a shared growth. And one of the key strengths of this workshop is the inclusion of facilitators with lived experience. It's just not me. With me, there is Cody and Rob, who are people with lived experience who kind of deliver these workshops along with me. And their insights adds authenticity and depth, helping participants connect with the real world perspectives in a very meaningful way. And having done these workshops in 2 different locations and 3 different workshops, what we've got to feel is that the best part of the workshop is that lived experience facilitation there. So I'm so happy to be part of that team. So our modules, the modules that I'm going to be talking to you about later on, are grounded in research-based and best practices, and have been tested across Canada. And this ensures that tools and strategies that are going to be shared during this workshop are effective and relevant to the different care settings. These unique features come together to create a comprehensive learning experience that equips the participants with the skills, knowledge, empathy, and that's actually needed to reduce stigma in our work settings. So where have we reached out so far? So during the months between May and June, we did about 3 workshops, and almost close to 60 beneficiaries were part of this workshop at 2 different locations. We did 2 workshops in Thompson with the Thompson Clinic, which is the newest HIV clinic in Manitoba, and then 1 more in the Interlake region with the Southeast Resource Development Council partner agencies. So and it included direct service providers like doctors, nurses, clinicians, social workers, and managers, community outreach members. Altogether, we totaled about 11 hours of learning and engagement, and led by the 3 facilitators. So this variety of participants, all the way from frontline service providers to managers, demonstrates the wide reach and the relevance of these workshops. Each role brings with it its own perspective, contributing to a richer learning environment. This diverse mix helps us foster the kind of collective understanding that's needed to tackle stigma across all levels of care. So at the end of this workshop, of each of these workshops, participants were asked to reflect on their experiences and identify areas where they felt they had grown. And we are very happy to share that participants from both the sites, the 3 different trainings, demonstrated significant growth in the several key areas that's been mentioned here. Almost 80% of the participants stated that they were able to develop a deeper understanding of stigma and the personal, social, organizational factors that shape stigma. This awareness is crucial for recognizing and addressing stigma in their everyday work. Again, a majority of the participants learned to engage in meaningful self-reflection, especially on sensitive topics like STBBIs and substance use. This helps fostering greater empathy and mindfulness when interacting or engaging with service users, our clients. Participants reported feeling more confident applying the strategies and tools. When I say tools, it's also the skills introduced during the workshop. This is very essential for sustaining the change beyond these sessions as well, because we want people to kind of come to these workshops and go back and start working on the concepts or working on the frameworks or the tools that has been given away. And we saw that in the feedback coming from the clients. These reflections kind of highlight how the workshops have not only provided new knowledge, but also created space for personal and professional growth, equipping um, participants to better meet the needs of people who they serve. Now, what contributed in the framework of the module itself? What contributed to the learnings? Now, what we got to know is we've gathered some insightful feedback that highlights these key elements of our trainings. One of the standout contributions to learning was the emphasis on peer discussions. When I say peer discussions, their own peers within the work environments, case studies, and interactive activities as well. Participants reported that these elements facilitate deeper understanding and engagement, allowing them to connect theory to practice effectively. In some instances, we saw the engagement go so deep that people who are actually the front end to the people who are in the back end, they kind of engage in discussing about how their work environments are actually perpetuating stigma. And they were immediately thinking of, well, we need to change these settings in our office. We need to remove these posters. We need to put up posters which are friendly. This is how we're going to communicate. Those kind of discussions were happening. This is in that peer setting. Another significant factor was the opportunities for self-reflection on personal attitudes and beliefs. Many participants noted that taking time to reflect on their own biases helped them identify areas of growth, understand how these biases might affect their engagement with clients. Video content was another key aspect of this whole thing. We kind of mixed different media to kind of bring about these understanding. In conclusion, what I would like to say, the feedback from participants underscores the importance of interactive and reflective elements of our training. By incorporating peer discussions, exploring stigma at multiple levels, encouraging self-reflection, utilizing practical video content, and engaging in role-playing, we can create a richer learning experience that empowers participants to make meaningful changes in their practice as well. Now, let's take a moment to highlight what participants enjoyed most about the workshop. Their feedback actually provides valuable insights into the elements that resonated with them and contributed to their learning experience as such. One of the most common sentiments that was expressed was all parts of the workshop were beneficial. I learned a lot that I can put into practice. This indicates that comprehensive nature of our workshops was well received, and participants felt equipped with practical tools to implement in their work. The participants also appreciated how very interactive and practical sessions were. This kind of hands-on approach is vital to adult learning, as it allows individuals to engage directly with content and apply their knowledge in real-world scenarios. And you can see the many different responses here. And lastly, participants highlighted the value of discussing stigma and trauma-informed care. One participant actually remarked, it helps to be more sensitive and empathetic when dealing with people with lived experience. This shows the understanding that nuances of stigma and trauma is essential for fostering compassionate care. In summary, I would like to say the feedback we receive reinforces the effectiveness of the workshop, being interactive, practical, very empathetic in its approach. By focusing on real-life applications, facilitating experience sharing through lived experiences, and addressing the need for community outreach, sensitivity, we can continue to make a meaningful impact in reducing stigma, very specifically STBBI stigma. So these workshop, we did encounter a lot of challenges. So I will share with you, and here are some of those challenges during the first year of this rollout. While we experienced strong engagement, we also faced a few barriers, and that we need to address moving forward. So one of the key challenges was the varying level of pre-existing knowledge among participants. This diversity meant that some participants needed clear information about referral pathways and resources. Many expressed that they required more guidance on how to implement and what they learned effectively in their practice. And one of the other things that they mentioned was about time constraints. Several participants felt the workshops workshops, all of those three ones, were either too short or lacked some sort of effective time management to thoroughly cover all the topics. This feedback highlights the need for us to optimize our scheduling and duration and ensure comprehensive coverage of content is maintained throughout the workshops. And as we navigated these challenges, we identified several important lessons. First, there was a knowledge gap among participants. Many expressed a strong desire to learn more about non-stigmatizing communication, trauma-informed care, effective stigma reduction strategies. This clearly indicates areas where we need to enhance our curriculum to better meet their needs as well. Another significant insight was the value of self-reflection itself. The workshop encouraged participants to examine their own biases and how these biases come in the way of engaging with clients and how they can come as stigma when you are actually seeing your clients. And this self-awareness is essential to address STBBI related stigma effectively. Lastly, we found that incorporating lived experience facilitation is vital and effective model of knowledge translation efforts. Participants resonated with these narratives, and we plan to continue this approach in our future trainings as well. Just to give you a glimpse of what happened during the trainings is some of the workshops have scenarios which describe a person in a difficult circumstance when facing structures such as a clinic or something like that. But our facilitators with lived experience came up with their own scenarios that they faced, and that was much more connecting with the people, participants who were getting trained during the workshop. So it meant more to them when they were part of this workshop. In summary, I would just like to say that we encountered several challenges during this year. They have provided us some sort of valuable lessons. Going forward, we need to kind of make sure that those things are addressed, and so that we can actually break down the harms of stigma and discrimination. So some of the key reflections that emerged during the first year of this initiative was one of the most impactful takeaway is the effectiveness of incorporating lived experience into the workshops. Hearing from individuals firsthand experiences brought the realities of stigma to life in a way that resonated deeply with participants. It reinforced the importance of human-centered learning, ensuring that future trainings continue to integrate these voices will remain core and essential for going forward as well. Another key insight is that ongoing support for health professionals post-training is crucial. Training alone isn't enough. It's just the beginning. Participants need follow-up guidance to effectively apply these principles in their daily practice. I'm not sure how we're going to do that, but we definitely think on those lines. The feedback we received from participants has also been incredibly valuable. It highlighted the need for continuous refinement of our strategies for stigma reduction. The feedback will shape the way we develop future workshops, ensuring that the content evolves to meet the changing needs of health and social service providers. Now, that's another key element of this partnership with the Canadian Public Health Association and the Center for Sexuality, which have developed these 5 different modules, is the evaluation part of it. Like once any participant goes through the training, there's a pre-training feedback that's sought and the post-training survey. And then after about a few months, there's a follow-up to that just to see that if there's anything new that they could learn, so that the participants who are getting trained through these workshops actually get to implement or are unable to implement, do they need further support? All the feedback that we're getting from these participants is going to feedback into refining these modules itself going forward. So that's a core element of this entire project as well. While many participants reported, going back to the key learnings, while many participants reported feeling comfortable discussing STBBIs, some still express challenges when having these conversations. This tells us that there's still work to be done in building confidence, particularly in using non-stigmatizing communication and trauma-informed approaches. Ongoing skill building in this area should remain a focus. Finally, participants recognize that the work of stigma reduction extends beyond individual practice. It plays a role in shaping the broader communities that we serve. Many expressed a desire to continue learning and recognize the importance of education and empowering them to reduce stigma in meaningful ways within their communities. One of the things is that these reflections provide a roadmap for us where we need to focus next and continue to integrate lived experience, offering ongoing support, refining our strategies through feedback, and ensuring that providers feel empowered and confident in their roles. It's clear there's momentum already that's set, and I think we should keep building on it. And we are really excited to take these lessons forward and also shape our future strategies. In terms of next steps, here's what's coming. So one of the most encouraging signs of the workshop success is the request that we've received for advanced training. One of the sites that has already done a training with us, one of the workshop with us for the entire staff, wants us to do a follow-up workshop, which highlights the participants' strong interest in continuing their learning. And this also tells us the topics we covered resonated deeply with them, and participants see the value of ongoing professional development and stigma reduction as a key component of that area. And looking ahead, we are planning to expand these workshops to more sites in Manitoba. Our goal is to reach a broader range of healthcare and social service providers across the province. And this expansion will allow us to build on what we've learned so far and create a larger network of professionals so that we are better equipped to address the stigma challenges and also to ensure that we provide trauma and violence-informed care. And in the long term, our hope is that these workshops will become a core part of our capacity building efforts in the province. By ensuring access to this kind of training, we can help foster more inclusive, empathetic, and non-stigmatizing environments across multiple sectors, and very particularly the harm reduction and STBBI networks as well. We are excited about these workshops, and we're looking forward to continuing this important work, not only through expanded training, but also through ongoing collaborations with sites and providers who are committed to reducing stigma in their communities. Well, these modules wouldn't have, like this whole approach wouldn't have been possible without the tons of years of work that Canadian Public Health Association put in along with the Center for Sexuality. These modules were in development from the year 2014. They've been continuously refined. There's a lot of peer-reviewed literature that has been considered in developing these modules. Consultations with community members, consultations with healthcare providers, and also looking at some of the best practices. So it's evolved over from 2014, and the most recent ones are probably in the 2022 ones. So the first one that's called Exploring STBBI Stigma is one of the first introductory workshops. And this is aimed at health and social service providers. And it kind of talks about how it affects people, how stigma affects people, and the ways to create more inclusive and welcoming environments. And the next one, which is called Moving Beyond Basics, and this is an advanced workshop for those people who are already providing STBBI services. This aims to kind of improve conversations about sexuality, give them a lot of skills in the areas of substance use and STBBIs as well. So there's so much to take away from each of these modules. One other thing about these modules is that these are modules that considers a lot of engagement with the participants. There's so many activities. There's tons of reflection activities, and that's what makes the participant think about their own values and how that can interfere with our engagement with our clients. So these are not short workshops. I would recommend a 3-hour workshop, but they're actually a 5-hour workshop. So 5 hours would be fantastic, but considering the time that we got, that might be a challenge. So this is the other workshop. It's called Challenging Organizational Stigma. And this workshop helps participants assess their organization strengths and challenges in reducing stigma and develop strategies to improve these services as well. Again, this workshop is for 3 hours. Recommended is for 5. And the other one, which is more recent ones, which have been developed pretty recently, was reducing stigma through trauma and violence-informed care. And this one helps professionals understand how trauma and stigma affects clients and equips them to apply trauma and violence-informed care to create safer and more inclusive spaces. And this workshop is for 6 hours. So I'm just letting you know the length of these workshop, and the reason why these 6 hours has been recommended is also because there's been tons of work that's been done, and these modules have actually been piloted with service providers across Canada, and the feedback, based on the feedback, these are the recommended hours of workshop as well. And there's one other workshop, which is also pretty recent, and this is it's done on an online thing. It's about 8 hours, um, and it's done over 2 days and helps program managers, administrators, and service providers explore how different forms of stigma intersect and impact health. This is pretty a large module, and it's done virtually as well. This is actually a virtual module. So these are some of the modules that we'll be rolling out in the coming years, depending on what's the requirement of the partner agencies are. Having said that, this comes to the end of my presentation, and I would like to thank the Thompson Clinic and their participants for really engaging in this program with us. And they are looking forward for us to come back there. And we are really looking forward to kind of continuing the relationship with that fantastic team over there. And also SERDC, that's Southeast Resource Development Council. We've had some fantastic teams over there, which we worked together. And we did some amazing workshop, and we did some wonderful work together. And your learnings that has given us some confidence to kind of move forward and start recruiting more partners in this entire effort. Yeah, and thank you so much for everyone. And Ella, if somebody has questions, I'm ready to take those questions.
Thank you so much, Srinath. That was great. Um, if folks have questions, you're welcome to pop those into the Q&A feature. We have a good amount of time for questions, so we welcome any questions for Srinath. I'll also mention, as you're thinking about questions, I put into the chat our feedback survey. We're very grateful for any feedback that participants would like to provide. It helps us to improve our webinars in the future, and we really value that feedback. So have a look in the chat if you'd like to complete that. And again, feel free to send us any questions you might have.
And if any of the partner agencies are interested to kind of work on this, please do let us know. So we will reach out to you, and then we can plan delivering these workshops. So
That's great. We'll include contact information in a follow-up email in case anyone wants to get in touch, either with more questions or to schedule training.
mhm. Sure.
So someone asks if these modules are available online for folks to implement, or is this a training that you and your staff team would come in to provide?
Yeah, I think these modules, they are available, not everything. A few of them are definitely available. And then this phase, what CPHA is also doing is that these modules that I spoke about have been revised and updated, and they are seeking to kind of do an in-depth follow-up study about how's the impact of this. That's been the missing part of this entire thing. So of course these modules have been developed based on evidences that have been gathered, and also the looking at best practices, but they're looking at the long-term sustainability of these practices. So these modules have been updated. Of course, CPHA would be very happy to work with you if you are willing to kind of look for these modules as well. Yeah.
Perfect. And we can include a link to the modules in our follow-up communication as well.
Sure. Absolutely.
Any other questions from our attendees?
And just on a positive note, I would also like to state that there's been several requests from different partners in the province to deliver these modules. We are looking to kind of work with them. But at the same time, there are challenges about how many of these workshops we could deliver. That's another challenge that we have to consider when we are planning to work along with different partners. But it's good to see that interest from different agencies.
Great. I'll give another minute for any questions that come through. And seeing none, I just want to thank you again, Srinath, for your time, for your excellent presentation, and for sharing with us today. Very happy to have you. And we will include your email in our follow-up so folks can get in touch if they'd like. And thank you again, and thanks to everyone for joining. We hope everyone has a great day.
Thank you. Have a nice day, everyone.